Welcome to this AviClear treatment demonstration. Ensure that your patient fills out all of the intake forms, including the consent form. The supplies you will need for this procedure are as follows: a headband to hold back the hair, 4x4 and 2x2 gauze, 2 bowls of clean water, 1 for washing and 1 for treating, a good degreasing facial wash, medical grade acetone, gauze mask or 4x4 gauze for the 3-minute hydration, cotton rounds or 2x2 gauze lightly moistened for placement under the patient treatment goggles, 1726 nanometer goggles for the provider, a water spray mister or additional gauze for hydration during the treatment, and a minimum 30 SPF sunscreen for application post-treatment. Wash skin thoroughly to ensure the removal of any surface impurities. Degrease the skin with medical grade acetone. Saturate the skin with water for at least 3 minutes before treatment. Everyone in the treatment room should be wearing appropriate eyewear. Enter the appropriate settings for your patient, starting at 19 joules per centimeter squared. Titrate the energy appropriately according to the patient's tolerance. The indicator lights will remain blue if you keep proper contact throughout the pulse. Activate each pulse with your foot pedal. As you move the handpiece across the skin, use a 50% overlap to ensure complete coverage. Every 1 to 3 pulses, use a wet gauze or a spray mister bottle to moisten the treatment area. Use all 300 pulses for the entire face. Tuck your bottom lip in. To ensure proper contact, instruct your patient to tuck in the bottom lip for the area under the mouth and the chin, and to tuck in the top lip for areas under the nose. I might wet you a little bit, and if you could, tuck your top lip in. For smaller areas, like the nasal alar, a single spot pulse may be necessary. For more sensitive areas, like the forehead or other less fleshy areas, you might want to try tapping during the pulse. To help dissipate the cold sensation in those same areas, try pressing with a gloved finger after the pulse. At the conclusion of your last pulse, apply 30 SPF or greater sunscreen. Three treatments spaced approximately 4 weeks apart are recommended. And be sure your patient has arranged for their next scheduled appointment.